That's probably the most interesting because in the past, CIOs and CTOs have taken a very risk-adverse strategy. I go with a vendor-driven package. The vendor does everything for me. I hold the vendor accountable. I make sure the data is not accessible, not available. It's not on the web. It's not in the cloud, simply because I don't want to have a breach. That goes in direct conflict with what meaningful use dictates, and the 3 stages of meaningful use are, which is I make data readily available. I need to have a patient portal that my patients can see exactly what is going on with me, both in terms of my clinical outcomes and my financial outcomes. So the CTO, CIO is now faced with going from a very protective environment to one that has all the proper securities in place, but yet has all that data readily available. They also have to embrace new technologies. So having wireless networks in place, putting in mobility applications, having it available on smartphones. Again, you're pushing out data to make it accessible, to make it more readily available to the consumer patient. By the very nature of doing that, you're exposing yourself to risk. So that is the same, if you go back to the retail market, that is exactly the same problem that they have in the retail market. If I look at the Amazons.com, what made them successful was getting the consumer to literally directly deal with their purchase, and yet they exposed themselves to all sorts of security potential breaches that they have addressed in a good fashion. So that's what the CTO, CIO is faced with in today's world. I think looking at middle-level folks in the healthcare space, one of the things that they traditionally would focus on was, I need to become physician affinity. I need to understand how I deal with physicians better because they are my provider of care. And that was probably the precursor to putting together who's the consumer and who's the customer, and it was the physician. Well, actually the consumer and the customer is the patient. So expanding that, and then what models will work? Looking at retail, not retail health, but just retail and manufacturing in general, you start learning, how do I reach my consumer? What is my consumer looking for? What is the messaging that I need to? How do I check that my consumer is actually getting what they need and they're happy with my services? And that all gets into a different marketing model that is very reflective of what goes on in retail. So if you look on commercials today in healthcare, they don't talk about clinically we are the best. They talk about personalized stories and how I couldn't go anywhere else and I went here and now I'm alive, or my child's alive. And they touch a human chord that everyone identifies with, and they say, you know what, I want to go there. So it's really that personalized touch, touching the individual, getting to know the individual. That's what consumer medicine has really turned into. With physicians, one of the things that they're teaching physicians and physicians to be now is make sure when you end that interaction with your patient, whether it's a slight touch on the shoulder or you reach over, just want to make sure you're okay, and always use their name. So it's that personalization that probably 5, 10, 15 years ago was missed simply because people were so pressed for time in making their rounds and taking care of what was important.